Aboelwaffa, que vous êtes conseillère principale en santé numérique chez Health.enabled.
You're working at
Vous aidez les gouvernements et les
health.enabled, where
partenaires à
you're working
renforcer les
with
écosystèmes de santé numérique. Vous allez nous faire une
partners and
présentation sur la
governments
santé
to
numérique dans les
use
contextes fragiles
e-health, and you
et
can tell us
conflictuels.
about
Je vous laisse la main.
fragile and
Thank you very much,
fragile
and thank you very
context
much for
with
the
areas with
invitation. I've
conflicts.
certainly learned a lot today and happy to share with you. So what I'll be talking about today is the results of a review that we have done looking at the different digital health solutions in fragile and conflict settings. So we have interviewed different organizations, so MSF, ICRC, UNICEF, UNHCR, UNRWA, and many much more people on the ground in different countries between Syria, Lebanon, Niger, Mozambique, to understand what is the scale and scope of the different... So Maxime showed me in the morning, but I kind of forgot which.
This goes forward.
Okay, yeah.
You only need this.
Yeah, perfect. Thank you very much. So what we try to look at is the scale and scope of the different digital health solutions that are being used within the fragile and conflict settings. And as I still have your attention before my 15 minutes, I'll start with my 3 main messages. So digital technologies, as everyone talked today, they are already being used, they are helpful, but they're only helpful in context. So as Raoul was just saying, you don't look for a solution to which you try to find a problem, but it's only useful when you're actually addressing a current problem that is being faced. The other point that I want to make is that historically, crisis used to kind of be systematic. So emergency, recovery, response, development, this is how we have been used to it. This is not the case now. Now we're facing multiple complex emergencies, and we're facing protracted crisis in which an emergency happens over another crisis, over, I don't know, in simple terms, it never rains but it pours, where you have floods, where hurricanes, cholera, political instability, and so on. And many countries are facing this right now. So the response is very much different, and the humanitarian action also needs to work differently to be able to respond to that type of crisis. And my third point is that digital technologies are not a silver bullet, so they just won't come solve whatever is there. The system needs to be already there. The system needs to function in a way that allows digital technologies to support that. And with that, I start my actual presentation. Yeah. So in context, there are now around 2 billion people that are living in what is called fragile and conflict settings. So this is basically a quarter of the world. And within that space, almost half of the world, half of the children living in fragile conflict settings are zero-dose children, which means that they have never been vaccinated. And through my presentation, I'll be using vaccination as a lively example of the different challenges that are being faced and the different uses of digital health technologies. But what works for vaccination would usually work for the rest of the healthcare system, but it's just to illustrate, and because it's the work with Gavi, the Vaccine Alliance, specifically focused on vaccinations. So what are the different challenges that is facing immunizations in fragile and conflict settings? So within those settings, the realities are very difficult. So one of the main things are denominator challenges. Whenever a crisis happens, population movements, a lot of people move from different places, and you're unable to first locate where are those people, how many of those are children, who is vaccinated, who is not vaccinated, and based on that, then it becomes very difficult to understand the supply of vaccines. So where are the children, but where are the vaccines? Which vaccines are needed? How many of those vaccines that are needed? And then this becomes a massive challenge. And then you have the problem of when you face, for example, wars, then like infrastructure, like healthcare infrastructure is targeted. So you have no visibility on which infrastructure is targeted, which is not, where are your supply chains, do you have cold chain in which like you have storage for vaccinations or not. So those are different realities that happen within the different fragile and conflict settings, and also the legal status of the population. In many places, refugees do not have a legal status, cultural barriers, language barriers. So the challenges are already a lot on the ground, and the humanitarian system has to work with those realities on the ground to be able to deliver those services. So this is just to give like a landscape of how does it look when you are in those settings. But we acknowledge that the paper system has been helpful so far, but also the paper system is not designed for long term, it's not designed for emergency responses, and it has many drawbacks. One of them is that you can have refugees who are coming with their papers completely like closed or not there, and you don't know which child is vaccinated or not, to which levels of vaccinations, and what do you need to do, how do you keep track of them, and so on. So with that, there are some interventions that has been used very, very usefully in those settings. And since 2010, after the Haiti earthquake, this is when the use of technologies has been very much under the spotlight, because during the Haiti earthquake, people were already using SMSs to try to locate who is where, who need help, and to try to map the population to understand how to better do the response. And then came COVID, and in COVID, we all know like there was massive use of telehealth, there was a lot of use of contact tracing that was very helpful, and this has put really digital health into a more formal place of trying to look at what sort of digital technologies are being used. And many colleagues has talked already about DHIS2, and as it is one of the more established systems within a lot of settings, I would like to highlight also the use of DHIS2 in Mozambique. So in Mozambique, it was one of the complex crises where you had multiple crises happening, like floods, hurricanes. So it's a country that is very vulnerable to climate change, but also armed insurgencies and COVID, and together all of them has compounded the impact on the healthcare system. So in 2019, pre-pandemic, there were 97,000 children who are zero dose, so who have never received a dose of vaccination. By 2023, this number has moved from 97,000 to 750,000. So this was a massive scale, which leads, so when you have that number of zero dose children, that leads to even more outbreaks. So there was a very good use of DHIS2 to be able to locate the children and do microplanning, in which you understand where are the children and target the campaigns and monitor the campaigns. And in a very short while, the country has managed to, in actually a pilot, and this was one of the problems, but in a pilot, and we have a UNICEF colleague here who have done much of that work, shaking his head. But within a small period of time, the country has already vaccinated around 19,000 children, and this is expanding now as well. So in general, there are many tools that are being used. So there is like health management information system, which is basically the DHIS tool. There is geographic information system, and this is mostly used to be able to understand where are the different populations. So for example, in Djibouti, the mobile clinics have to move for like 10-15 hours to be able to locate where the population are based. But when you have geographic information system, then you're able to track population movements much easier. You have electronic health records in which the UNHCR colleague was talking about, to be able to understand specific records for populations and track them through their migration. And it was very interesting as well after the war on Syria, where a lot of Palestinian refugees were already in Syria, but they had their records with UNRWA. So with the Syrian war, population moved to neighboring countries, but they were still tracked and still have their electronic records intact with the UNRWA. Telehealth services, like real-time connection data use, unique IDs. So there is like a variety of tools that that are being used. However, and this is like the however part, I mean, crisis comes in very different shapes and forms. And crises are not the same. So trying to say what digital tool would work for crisis, and this is a question that actually, like, I would get a lot. So what digital tools do we want to, without the context and space? But you need to have the context to understand, because you have countries with chronic fragilities in which they have been in wars and then pandemic and then outbreaks. But the country, for example, has a very good health workforce and still a strong like public health system, and have a lot of experience with health systems. So this is, for example, Lebanon. Lebanon has had multiple crises over the past 15 years, but the teams there have had long-term use with digital technology, so they're able to deploy, they're able to change, they're able to adapt with new tools. This is very much different than countries where the infrastructure is already not there, so deployment becomes very different. Then you have acute emergencies where the response has to be like really just immediate in countries that has not been used to those types of situations. And then you have wars in which also the situation is very different, because with wars and with conflict settings, you're not able to deploy personnel from outside the countries to inside the countries in a way that, for example, it's a hurricane or a flood. So the situation is very, very different, and nothing would work in all of the situations. So context really matters, and it seems like a simple thing, but you'd be surprised how much it is not actually taken into account. So we tried to come up with a few considerations that would work in multiple settings. And these are the results from the Digital Health Monitor, looking specifically at fragile and conflict settings. And as you can see, so if you look at the results from the Digital Health Monitor, you usually would see like certain trends. In fragile and conflict settings, as you can see here, there's no trend. Some countries are really good at infrastructure, some countries are really bad at infrastructure, some countries have a lot of services already in place, some countries don't have, so it's just, it is really different, which is just to emphasize that context is very different from one country to another, and how you design and deploy in those countries must take into account like the whole infrastructure within the country. But there are some principles that would be best to have been like thought previously. Like, when crisis happens, it's important to have preemptive tools to be able to deploy. And those tools has to be adaptive, because the nature of crisis changes. So with that, it's very important to adapt the tools based on the crisis and based on the country, so you don't have to like reinvent the wheel every single time. In many also crises, there is, of course, like a problem with infrastructure, which means also no internet. So offline first digital tools that would be able to work offline and would be able to save the data every time. And also pre-built solutions for rapid deployment. It's not enough to wait until the crisis happens and then you start thinking, okay, what are we going to do now? But pre-built solutions that could be deployed, and that could be deployed remotely. Because when the war happened in Gaza, there was a lot of conversations on, there are a lot of solutions that could be deployed, that could be supportive, but it's impossible to have in-country deployment. So you have to have remote deployment, and many tools that are already designed are not ready for remote deployment, and they need like a heavy level of IT people to be able to actually make them work, which is impossible in the case of rapid emergencies. And the other thing also, which colleagues has talked about, the tools that are being deployed has to have simple workflows. Most of the time you have different team members and different agencies are interested in all sorts of data. Now we need this for that sort of planning, now we need this for like donor reporting. And within those crisis settings, when you have also only one person who is like the health workforce of the whole neighborhood, if you even have that person, you can't burden them with that amount of data. So you have to be like really strategic with the points that with the data points that you actually want to collect, and consider that this is really like an emergency setting where you have very, very stretched workforce, and most of the time also very stretched governments. And finally, user-friendly features, and this should go without saying. This should go without saying for all digital tools that are being deployed, but more so within crisis settings that really need to have things that are simple and that are fast. And finally, some of the implementation considerations. I'm really happy that many of the colleagues today talked about implementation research, about context, about how do you, like, you can design like the best tool, but if you don't take into account the realities of implementation in those different settings, this tool is never going to kick off. So one of the things, and also colleague talked about it, is data governance and security. Those settings are mostly have governance challenges. So the traditional governance approaches wouldn't work, but also the risk of having sensitive data in the wrong hands is much more costly for human lives and for the security of people and for the security also of the healthcare workers. And coordination among humanitarian actors, and everyone talked about this today, but you also see this happens. Each one has their solution. Sexual reproductive health has their solution, vaccinations their solution, mental health their solutions, but then how are you going to make this actually work on the ground? How are you going to make this work with a mother that has a mobile phone that is not charged, doesn't have data, and she's not going to download one app for vaccination, one app for mental health, one app for sexual reproductive health, another app to call I don't know whom? So like coordination between different humanitarian organizations to streamline what do they want to deliver on the ground is really critical. And that seems like obvious, but it doesn't happen, and you still have different solutions. And with that, actually, I want to highlight one initiative by ICRC, which is amazing. They are now working on what is called the emergency shelf. So to try to bring together different solutions from different organizations and use that and repurpose them in different settings, also to avoid duplication within those settings. And finally, because this was specifically done for immunization, so mainstreaming immunization within the broader healthcare efforts, not to duplicate and not to have like a siloed healthcare, not to have like a siloed emergency response. Yeah, so that would be all. Thank you very much.
Thank you very much. Merci beaucoup, Yara.